Hello, dear students. Today we will discuss on topic Code of Ethics for Pharmacist. Module 1 Introduction. The quest to develop an ethical framework for Western civilization was begun over 2000 years ago by Socrates. He approached ethics as a science as being governed by principles of universal validity, so that what was good for one was good for all, and what was my neighbor's duty was my duty also. However, the acceptance of the Socrates approach has proved burdensome. After 2000 years of efforts, mankind universally adhered to not even one ethical principle. For the first time, the word ethics was used in ancient Greek by philosopher Aristotle to refer to the science that studies the well-wisher of human nature. Ethics, a system of moral norms of human behavior, any social or professional group. The first information about the ethical side of the pharmacist was found in ancient Indian and Chinese culture. A special place in the history of medical ethics is a period of medicine of Hippocrates. He made first attempts to codify the rules of medical ethics. Pharmaceutical ethics first arose with the opening of pharmacies and the emergence of the first pharmacists. In Ukraine, this was the end of 16th century. After 2 centuries, in 1789, to regulate pharmaceutical activities, pharmacy regulations was issued, which came in a set of laws, provisions of which were determined moral requirements of pharmacists. During 19th and 20th century, population growth and development of pharmaceutical science have led to a sharp increase in the number and range of pharmacy medicines. As a result, in modern society, particularly in pharmaceutical community, arose the problem of more strict regulation of pharmaceutical activities, and it was done through the establishment and continuous improvement of current legislation in the field of pharmacy. Now, what is ethics? Ethics is a systematic study of what is right and good with respect to conduct and character. Professional ethics establish a pattern of behavior that person comes to expect from members of the profession. Once a consistent pattern of behavior is seen by patient, they expect same behavior to remain constant, and their expectation become part of the relationship they establish with the professional. To better understand the role of and necessity for ethics in pharmacy profession, one must first look the characteristic of the profession. Module 2 Objective for making ethical regulations. Any governing profession exists to serve the society. The mission of the pharmacy profession is to render services to humanity with full respect for every individual patient. The public have great trust in the knowledge, skills and professional judgment of pharmacists. This trust should be maintained by a pharmacist throughout his/her career. Should maintain high standards of personal and professional conduct, up-to-date knowledge and professional competence, for which the registered pharmacist should try continuously to improve his knowledge and skills, and should make available to their patients and colleagues the benefit of their professional attainments. The registered pharmacist should practice methods of practice founded on scientific basis and should not associate professionally with anyone who violates this principle. Hence, the regulations made for practice of pharmacy laying down responsibilities of pharmacist towards patient, neither registered pharmacist and public in general. Primary reasons to regulate pharmacy profession are to improve quality of healthcare, to ensure that pharmacists maintain high standards in their duty, to reduce cost of healthcare, to inhibit criminal abuse of medicines. All pharmacists registered with Pharmacy Council of India need to comply with the PCI's Code of Conduct, which provides guidance on the ethical framework through which effective health services should be delivered. The PCI's code contains important standards for practitioner behavior on providing good care, including shared decision making, working with patients, clients, other practitioners and within the healthcare system, minimizing risk, maintaining professional performance, professional behavior and ethical conduct, ensuring practitioners' health, teaching, supervising, assessing and research. Summary of important ethical principles. First, a pharmacist recognizes the health and well-being of the consumer as their first priority. A pharmacist recognizes consumers who are particularly vulnerable and tailor the provision of care accordingly. A pharmacist should act to prevent harm to the consumer. Second, a pharmacist pays due respect for the autonomy and right of consumers and encourages consumers to actively participate in decision making. A pharmacist should pay due respect to the dignity and privacy of the consumer, including respecting the consumer's individuality, respecting their right to refuse advice or treatment, and ensuring the privacy and confidentiality of the consumer. Third, a pharmacist upholds the reputation and public trust of the profession. Fourth, a pharmacist demonstrates a commitment to the development and enhancement of the profession. He will commit to advancing the profession through involvement in activities including training staff, engaging in teaching, acting as a preceptors, mentoring students, interns and colleagues, engaging in discussion and participating in initiatives to develop the profession and showing professional leadership. Sixth, a pharmacist maintains a contemporary knowledge of pharmacy practice and ensures health and competence to practice. Seventh, a pharmacist agrees to practice only under conditions which uphold the professional independence, judgment and integrity of themselves or others. Eighth, a pharmacist conducts the business of pharmacy in an ethical and professional manner, primarily in the best interest of the consumer, paying due respect to the colleagues while upholding the reputation of the profession. Ninth, a pharmacist works collaboratively with other health professionals to optimize the health benefit of consumer. Now, Module 3, Code of Pharmacy Ethics in India. Each applicant at the time of making an application for registration under the provision of the Act shall be provided a copy of the declaration as specified in Appendix 1 along with copies of Code of Pharmaceutical Ethics and Pharmacist's Oath by the State Pharmacy Council, who shall submit it duly signed. Privileges of persons registered as a pharmacist on the Register of State Pharmacy Council. Subject to the conditions and restrictions laid down in these regulations regarding practice of profession of pharmacy by persons possessing approved pharmacy qualifications, every person whose name is for the time being entered in the register of the state in which he is for the time being residing or carrying on his profession or business of pharmacy shall be entitled to practice as registered pharmacist and engage in the practice of profession of pharmacy, and to recover and any expenses, charges or any fee to which he or she is entitled in lieu of his/her discharging duties as defined by the Pharmacy Council of India from time to time. Displaying name of honor and registered pharmacist. Name of honor of the pharmacy business shall be displayed at or near the main entrance of each pharmacy premises in which the business is carried on. Name of registered pharmacist along with his registration number and qualification along with his/her photograph shall be displayed adjacent to the area where dispensing is carried out on in the pharmacy. Registered pharmacists shall display as suffix to their names only recognized pharmacy qualification, degrees or such certificates, diplomas and membership honors which confers professional knowledge. Honor to appoint registered pharmacist. The honor of a pharmacy business to which this clause applies shall appoint a registered pharmacist to be responsible for regulation. To be effective, the notice of appointment must be accompanied by a notice of acceptance of the appointment signed by the appointed person. An appointment may be revoked by notice given either by the owner of the pharmacy business or by on behalf of the appointed person. The appointment shall be automatically revoked if the person appointed ceases to be a registered pharmacist. Duties and responsibilities of the registered pharmacist in general. Character of registered pharmacists. The prime object of the pharmacy profession is to render services to humanity. Reward or financial gain is a subordinate consideration. Whosoever chooses his profession assumes the obligations to conduct himself in accordance with its ideas. A registered pharmacist should be an upright man instructed in the art of medicines. He shall keep himself pure in character and be diligent in caring for the sick. He should be modest, sober and prompt in discharging his duty without anxiety in his profession. A person having qualification in any other system of pharmacy is not allowed to practice modern system of pharmacy in any form. Dispensing against prescription of registered medical practitioners only. Every registered pharmacist shall dispense only those medicines as prescribed by the registered medicinal practitioner and shall not substitute the prescription. Practical training to students pharmacists. The owner of the pharmacy shall seek prior approval of the PCI to impart practical teaching to students of diploma in pharmacy, failing which the student pharmacists shall not be treated to have completed their diploma in pharmacy to make them eligible for registration as a pharmacist under the Act. The registered pharmacist shall impart practical training to students pharmacists as prescribed from time to time under education regulations framed under section 10 of the Act. Under intimation to the examining authority. Pharmacy inspectors to inspect pharmacies. The owner or a registered pharmacist shall allow and cooperate with the inspectors appointed under the Drugs and Cosmetic Act 1940 and section 26A of the Pharmacy Act 1948 by the State Pharmacy Council to inspect premises where drugs and compounded or dispensed. Maintaining good pharmacy practice. Membership in association for the advancement of his profession. A registered pharmacist shall affiliate with associations and societies of allopathic pharmacy professions and involve actively in the functioning of such bodies. A registered pharmacist shall participate in professional meeting as a part of continuing pharmacy education programs organized by reputed professional academic bodies or any other authorized associations organizations. The compliance of this requirement shall be informed regularly to Pharmacy Council of India or the state pharmacy councils as the case may be. Maintenance of patient record. Every registered pharmacist shall maintain the medical prescription records pertaining to his/her patients for a period of 5 years from the date of commencement of the treatment as laid down by the Pharmacy Council of India in Appendix 2. If any request is made for medical records either by the patient's authorized attendant or a legal authorities involved, the same may be duly acknowledged and documents shall be issued within the period of 72 hours. Efforts shall be made to computerize medical prescriptions record for quick retrievals. Highest quality assurance in patient care. The registered pharmacist shall not employ in connection with his professional practice any attendant who is neither registered nor enlisted under the Pharmacy Act in force and shall not permit such persons to attend the patients wherever professional discretion or skill is required. Exposure of unethical conduct. A registered pharmacist should expose without fear or favor incompetent or corrupt, dishonest or unethical conduct on the part of members of the profession. Application of other laws not barred. The registered pharmacist shall observe the laws of the country in regulating the practice of pharmacy and shall also not assist others to evade such laws. He shall be cooperative in observance and enforcement of sanitary laws and regulations in the interest of public health. Duties of registered pharmacists to their patients. Though a registered pharmacist is not bound to attend each and every person asking his services, he shall not only be ever ready to respond to the calls of the sick and the injured, but shall be mindful of the high character of his mission and the responsibility he discharges in the course of his professional duties. Pharmacist care, in addition to the provisions of Drug and Cosmetic Act 1945 and Schedule N of the said rule, the following provisions shall be included. No person other than a registered pharmacist shall compound, prepare, mix, dispense or supply of any medicine on the prescription of a registered medicinal practitioner, that is Schedule H and X drugs. A registered pharmacist shall review the patient record and each prescription presented should be checked for therapeutic appropriateness by identifying overutilization or underutilization, therapeutic duplication, drug-disease interaction, drug-drug interaction, incorrect drug doses or duration of drug treatment, drug allergy interactions, correlation of availability of drugs to avoid artificial shortage of drugs, clinical abuse or misuse, patient delicacy and secrecy. Patience and delicacy shall characterize the registered pharmacist. Confidences regarding individual's life entrusted by patients to a registered pharmacist and defects in the character of the patients observed during medical attendance shall never be revealed unless their revelation is required by the laws of the state. Prognosis. The registered pharmacist shall neither exaggerate nor minimize the gravity of a patient's condition. He shall ensure himself that the patient, his relatives or his responsible friends have that knowledge of the patient's condition which will serve the best interests of the patient and the family. The patient must not be neglected. A registered pharmacist is free to choose whom he will serve. However, he shall respond to any request for his assistance in an emergency. Registered pharmacist should not commit an act of negligence that may deprive his patient from necessary medical care, dispensing and supply of drugs. The various activities of dispensing like removal of drugs from the packing, filling the prescription, etc. may be performed under the supervision of a registered pharmacist by any person who has been trained to perform these activities. However, the actual dispensing of drugs to patients shall only be performed by the registered pharmacist after due verification of the prescription filled by others. A registered pharmacist shall undertake a pharmaceutical assessment of every prescription presented for dispensing. For the purpose of the Act, pharmaceutical assessment is defined as the point at which registered pharmacist applies his knowledge to establish the safety, quality, efficacy and rational use of drugs treatment specified by a prescriber. Patient confidentiality shall be maintained at all times. Appropriate information shall be provided to the patient or the caregiver and wherever possible. Understanding of the information should be checked. For all prescriptions handled by the pharmacy, patient details shall be checked and confirmed. Pharmaceutical assessment shall be made. Proper documentation shall be maintained. Assessment of the prescription should also include the prescription is legally valid or not. The prescription includes an appropriate dosage form and appropriate route of administration. The prescription is appropriate to the patient's condition. Duration of treatment is correct. Prescription is appropriate according to the patient's parameters like age and weight, etc. and previous medications. Prescription is compatible with other medications. Prescription is consistent with formulary and guidelines. If any possibility of side effects and adverse effect reaction exists. Contraindicated. Potential for misuse and inappropriate use of the medicines in prescription by patient exists. Prescription is complying with labeling requirements. Registered pharmacist as a citizens. Registered pharmacist as a good citizen possessed of special training shall disseminate advice on public health issues. They should play their part in enforcing the laws of the community and in sustaining the institutions that advances the interest of humanity, public and community health. Registered pharmacists, especially those engaged in public health work, shall enlighten the public for the prevention of epidemic and communicable diseases. At all times, the registered pharmacist shall notify the constituted public health authorities of every case of communicable disease under his care. In accordance with the laws, rules and regulations of the health authorities, when an epidemic occurs, a registered pharmacist shall not abandon his duty for fear of the disease to himself. Punishment and disciplinary action. It must be clearly understood that the instances of offences, professional misconduct which are given above do not constitute it which calls for disciplinary action. Circumstances may do arise from time to time in relation to which there may occur questions of professional misconduct. We do not come within any of these categories. Every care should be taken that the code is not violated. In such instances, the Pharmacy Council of India or state pharmacy councils have to consider and decide under the fact brought before them. Any complaint with regard to professional misconduct can be brought before the Pharmacy Council of India, concerned state pharmacy council for disciplinary action. If the registered pharmacist is found to be guilty of committing professional misconduct, the Pharmacy Council of India or concerned state pharmacy council may award such punishment as deemed necessary or make direct the removal altogether or for a specific period from the register. Deletion from the register shall be widely publicized in local papers as well as in publications of different pharmacy associations, societies and bodies. In case the punishment of removal from the register is for a limited period, the concerned state pharmacy council may also direct that the name so removed shall be restored in the register after the expiry of the period for which the names was ordered to be removed. Decision on complaint against registered pharmacist shall be taken within a time limit of 6 months. During the pendency of the complaint, the concerned state pharmacy council may restrain the registered pharmacist from performing his or her practice. Professional incompetence shall be judged by peer group as per guidelines prescribed by Pharmacy Council of India. Now, we will move towards conclusion. Hope you all have enjoyed the lecture. Module 4, Conclusions. Pharmacy is a moral practice and pharmacists have special moral obligations, including but not limited to promoting the welfare of patients, practicing them from harm and respecting their rights to self-decision. In order to bring comfort to patients and ease to pharmacists who is providing high quality and skilled paramedic aid, pharmaceutical community in different countries have realized that one document concerning rules of professional ethics state the principles and values of the profession is must that defines the role and responsibility of pharmacist to the public. Here appeared first code of ethics for pharmacists. Thank you. Goodbye. Take care and keep studying.